Good morning. Thank you everyone for joining. My name is Jamie Gaines. I'm the manager of state government relations at Boston Children's, and I'll be acting as your moderator and one of your presenters for today's sessions. We are so excited to share our new state legislative agenda with all of you. The agenda for the 2021-2022 cycle is focused on topics rather than specific legislation in order for the Office of Government Relations to remain flexible while committing to policies that advance the health and well-being of our patients throughout the Commonwealth. This means you will not see bill numbers that you may be used to seeing from past agendas, and instead will see those updated as the session moves forward. There are also two new areas of work that policies will be grouped into. Excuse me. The COVID-19 pandemic and the recent national spotlight on racism and police brutality have brought to the forefront the need for a systemic shift to refocus racial and health equity in the upcoming session. This also reflects Boston Children's Declaration of Equality, Diversity, and Inclusion when it comes to our commitment to confronting racism. While this and other areas of our agenda might be new to our department, we recognize that they are not new to many of you. We hope that applying a health equity lens to our policy priorities, you will join us in ensuring that an equity is part of all aspects of our advocacy work. Excuse me. The state agenda was assembled with feedback and support from internal experts, external stakeholders, as well as patients, families, and staff. Sorry. This agenda recognizes the intersectionality and relationship between many of these topics, and we hope this comprehensive agenda will find a place for you and your advocacy. A few housekeeping notes. All questions will be addressed at the end of the session. Please type your questions into the chat box anytime. If you have tech issues, our lovely intern Alexia is on the chat to help you. Excuse me. After today's session, you will receive a recording with the panelists' email addresses and a link to the session. You'll also get the slides and an evaluation and contact form. So with that, I'm going to have Alexia advance to our next slide. And we're going to talk a little bit about the objectives for today. Today, we're going to be reviewing the basics of the legislative process, just so that everyone understands how we got here. Then we're going to describe the development of the state legislative agenda. We're going to learn how to get involved. We're going to highlight our past legislative successes, and we're going to present our updated agenda. Then we're going to talk a little bit about how you can get involved. Next slide. So for today's speakers, you'll have myself, along with Shannon Moore, who is our Director of State Government Relations, and Amara Azibike, who is our Director of Behavioral Health, Advocacy, and Policy. Next slide. So with that, let's get started. Next slide. Just a couple of quick facts to ground us in the work. The legislature in Massachusetts runs on a 2-year cycle. So our bill filing deadline is going to be on February 19th of this year. That's part of the reason that you're not going to see those bill numbers that you're so used to seeing. Once we have the bill filed and we have the numbers, you're going to have an opportunity to testify. This is very similar to what many of you have done in the past. The difference will be is that we're going to be doing it virtually this year. So you can testify by email, by letter, or potentially even by video chat as an oral testimony live in person. If you have questions about this, you can always reach out to our office. And if you're on our CAN email list, you'll get lots of alerts about opportunities. The state budget is also filed every year and must pass. This is the only bill that has to go through every single year. The budget filing deadline for this year is January 27th. So again, keep an eye out on those CAN updates for all the opportunities to advocate on the budget. Hearings on the budget and issues will occur between March and November. So again, look out for those updates. The legislative agenda is going to guide our work, and we'll work in coordination with many of our partners and you, but it is not a comprehensive list of everything we work on. Many of you will remember that there are tiers to our legislative agenda. Just because you don't see the issue that you are most passionate about reflected on our legislative agenda doesn't mean that we don't work on it, and doesn't mean we can't help connect you to someone that does. Always reach out. We're happy to help connect you to the wider advocacy community. Next slide. So many of you have seen this slide before. I'm not going to go in depth. This is just to show you that the process of getting a bill passed in Massachusetts can be long, can be challenging, and can feel like a bit of a game. If you or your department is interested in learning more about how a bill gets passed in Massachusetts, please reach out and we'd be happy to come and chat with you and explain the whole process. Next slide. Same goes with the budget. This is a new slide that we created to help explain the budget because the budget is a really good opportunity for advocacy. Lots of our issues are actually worked on through the budget. So invite us to your staff meeting, come and have virtual coffee with us, and we're happy to walk you through the budget process. Just know this is a really good opportunity to get policy passed, and it's not just about the numbers. Next slide. So we understand that the legislative process is complex, and how is anybody going to follow along? I love this slide because it really shows a good process improvement Six Sigma lean version of the legislative agenda. Next slide. What's important to know is that we're here to help. We're here to answer your questions if it's on our issue or not. We want to help you navigate the legislative process and be the best advocate for kids and families that you can be. So you can always reach out. We're always here for you. Next slide. So when it comes to issue prioritization, there are a lot of factors that go into it. We know there are between 6,000 and 8,000 bills that are filed every year, and many of them can have an angle that has to do with kids. So what we do in the Office of Government Relations is we really ground ourselves in the mission. We think about our mission, we think about the child health impact, whether it's 5 kids with a rare disease or it's every kid in Massachusetts impacted by water quality. We think about the financial and operational impact. I hear it's hard to do brain surgery with the lights off. We also solicit internal and external feedback, and we think about the health and racial equity of how we can impact and change the world for the better. Next slide. These are a sampling of our coalition partners that we work with. Many of you will know many of these organizations. These are just some of the people that we help to make our legislative agenda move forward. They also have their own legislative agendas that we encourage you to check out on their websites. If you have trouble reaching out to them, please let us know. They work on great things that sometimes we don't have the capacity to work on. So we're happy to connect you and make sure that you're getting all of your advocacy goals met. Next slide. This is just a quick reminder that Boston Children's is a nonprofit organization, which means we do have some rules around our advocacy. The basic rule is that we are allowed to work on issues that are germane or relevant to the work that we do, but we are never, ever allowed to support candidates of any kind. So you'll never see Boston Children's Hospital supporting X person for president or X person for state senate. This can be a little bit confusing, and so we really encourage you to reach out if you have questions. If you're interested in campaign work, please let us know. We can help you navigate that wearing the correct advocacy hat. But it's really important that when you are on Boston Children's Hospital time, when you're using our equipment, we are not allowed to do any kind of political campaigning at any level of government. When it comes to issues, we're all in. When it comes to candidates, we're all out. Next slide. And this is just a quick reminder of the advocacy hats. We all wear different hats at different times. So whether you are advocating with your children's hat, your trade association, or as a private citizen, knowing which hat you're wearing will help you figure out what level of government and what your message can be. This can be challenging to navigate. So again, we're here to help. Next slide. And these are just a few of the advocacy opportunities that are going to be presented to you over the next year. And we're going to hope you engage with them, whether it's coming to more of our Caffeinate advocates, enjoying our voter registration virtually or in person, or testifying at the State House. We are here to help and to make sure that your voice, the voice of your patients, and the voice of our families is heard at all levels of government, but particularly at the state level. Next slide. And this is just a quick reminder. I saw Alexia put into the chat how to sign up for the CAN, or the Children's Advocacy Network. This is the best place to get our newsletter, our action alerts, and to join us in different advocacy efforts across the legislative cycle. Next slide. And with that, I am going to ask Shannon Moore, our Director of State Government Relations, to join us so she can share a little bit about the new and exciting legislative agenda. Shannon, all yours.
Thank you, Jamie. Again, my name is Shannon Moore. I am the Director of State Government Relations here at Boston Children's Hospital. My role on the team is to help advance the hospital's legislative and policy agenda at the State House by working with our state legislators, the other members of the GR team, and all of you on bills and regulatory policies that are important to benefit our patients and our staff. Prior to starting with BCH in March, I worked for 13 years with the state, and a lot of those were directly working for the legislature on legislation. So I'm very excited to be rolling out this agenda today. Just to orient us on the next slide, this is the agenda that was used during the previous 2-year session with a list of priorities and the outcomes of those priorities. And as you can see, it's kind of hard to read the slide, but there's a lot of wins on there. And you can also see that there's a lot of different ways that a priority can start out as a bill and then become state policy. I won't go through every single one of these, but most of the priorities on here had some kind of action, whether it was passed into law through a regulation or part of a bill. For example, you can see under health care access column, the first column where it says CHAC, C-H-A-C, an act relative to children with medical complexity was a study that we were asking for to ask the Health Policy Commission to look at complex kids and their healthcare needs. This bill was included as part of a larger package, and now the study is ongoing. You can see other things were accomplished through regulation, such as newborn health enrollment, which was started as a bill, but then Mass Health decided to change their regulations on their own with our advocacy. And then so at the top of the healthcare access, you can see telemedicine. Telehealth was a big priority of last session. As everyone knows, due to the state of emergency, the telemedicine and telehealth are currently being enacted through a series of executive orders from the governor, in addition to a bill that was also passed this past December and signed by the governor on January 1st that will kind of guide the work moving forward. So next slide, please. As Jamie mentioned in her introduction, the state legislative agenda for this year will be focused on topic-related matters rather than specific legislation to give our office the flexibility we need to respond to the changing needs of advocacy due to both the COVID pandemic and our focus on racial and health equity in the upcoming session. So again, this agenda is not meant to be a comprehensive list. It's just giving you a baseline of our advocacy and policy work for the upcoming 2 years. We've grouped this work into 4 topics, and these are in no particular order. You can see, and I'm going to go into these more in detail, but we have healthcare access, social determinants of health and health-related social needs, racial equity and social justice, and behavioral health. We recognize that there's a lot of intersection and overlap between all of these topics, and we hope that these topics will really work together and complement each other and really work in conjunction with each other to support the overall health of our patients. Next slide, please. So diving a little bit more deep into what all of these topics mean, we have kind of the traditional healthcare access topic, which was on our previous agenda as well. Through this topic, we are hoping to commit to ensuring all children have access to quality, affordable, and geographically appropriate healthcare while addressing health disparities that exist across the Commonwealth. We've defined health disparities as plausibly avoidable, systematic health differences adversely affecting economically or socially disadvantaged groups. Next slide, please. In healthcare access, we again are focusing on mass health coverage. Just during the pandemic, we know how important it is to make sure that kids have access to healthcare coverage, with both maintaining eligibility, making sure that the budget is paying for all these services and benefits throughout the public health emergency and beyond. We've also recognized that there's going to be a lot of work that's going to continue to be done on telemedicine and telehealth. We believe we are a part of a coalition of telemedicine and telehealth that will be working on continuing to make sure that telehealth services are accessible, both because people are having issues, kids have issues bridging the digital divide, whether it's because they don't have access to internet or the internet's not affordable. We also want to make sure that services are culturally and linguistically appropriate. Are people able to even get on to understand the instructions to get on to telehealth, and our telehealth services being reimbursed at appropriate rates. We've also included sections on here for additional topics, kind of to give us, again, the flexibility that to add additional topics as they come up. We believe that there is going to be an effort with our Cover All Kids coalition that we are part of to work on additional access for kids regardless of their immigration status. Next slide, please. So for our social determinants and health-related social needs section, we want to commit to policies that address and acknowledge the role that social determinants of health and health-related social needs play in the lives of our patients and their families. We've defined social determinants as the circumstances in which people are born, grow, live, work, play, and age that influence access to resources and opportunities that promote health and achieve health equity. Health-related social needs such as food insecurity, housing instability, or lack of transportation are real-time gaps in services that impede a family's health, well-being, and safety, and are associated with worse health outcomes when not addressed with targeted interventions. Next slide, please. So over the summer, when we conducted our legislative survey, these three topics were, we heard loud and clear that we should put these on our agenda for this year. People were really worried about housing for families. So we're going to promote policies that will promote safe, affordable housing with dignity, including housing tenancy preservation programs and homelessness prevention resources. So keeping people in their homes and preventing them from becoming homeless. We support policies that will improve access to safe, affordable, nutritious food resources for kids and families across the state. And we heard people were really concerned about transportation. We've heard that the MBTA is considering service cuts, and we know that sometimes these are targeted in communities disproportionately impacted in changes or reductions in services and schedules. So how can we make sure that investments in both the MBTA and alternative methods of transport are really being found in the budget and in policies that are being worked on at the State House. We've also included in this bucket, we've heard from people that are really concerned about affordable and quality early education and childcare, equitable public education opportunities for kids, making sure that the Student Opportunity Act is moving forward. And also we know that childhood environmental health exposures often, such as pollutants that cause asthma or lead paint in older housing stock often disproportionately impact populations in different ways. Next slide, please. Our next bucket here, we have our racial equity and social justice. We are committed to re-examining our work through the lens of racial equity, social equity, and health equity to better understand how these frameworks impact our policy agenda. We will be using a racial equity lens through all of the legislation that we work on, and just to make sure that we are taking those racial equity and social equity and health equity ideas into all of the work that we do. We've defined racial equity as the creation and proactive reinforcement of policies, practices, attitudes, and actions that produce equitable power, access, opportunities, treatment, and outcomes for all people, regardless of race. We will support legislation that upholds this value, integrate racial equity throughout our whole policy agenda, and focus on communities most impacted by structural racism. Next slide, please. So we were taking a look at what we anticipate the state will be working on, and as other topics come up, we will include these as well. The state legislature has identified racial inequities in maternal and infant health as a priority for this session. So we will be supporting legislative efforts to reduce racial inequities in maternal mortality and morbidity and promote equitable infant health. We are going to be working with some of our coalition partners to look at the juvenile justice bills that are going to be filed to ensure that children and youth have access to a fair and equitable juvenile justice system that aims to reduce ethnic and racial disparities and also to prevent kids from becoming involved in the system in the first place, like promoting policies that improve access to diversion and community-based interventions as alternatives to system involvement. And also we want to take a look at youth opportunity, both through youth jobs and connecting historically underserved youth to bridge to college programs. The state is doing a lot of work at taking a look at how to get underserved youth into appropriate either college programs or job training programs to give them a good start. Additional topics we put include family economic stability, which could be done through the earned income tax credit and lifting the cap on benefits. We all know that families sometimes hit this cliff effects problem when they start making more money and they start certain benefits drop off, and then they're unable to afford certain either food or housing because of the cliff effects. And then we've also included public education funding on here as well. Next slide, please. So next we will be hearing from Amara on our behavioral health agenda. Amara?
Thank you, Shannon. Good morning, everybody. My name is Amara Azubihe, and I'm the Director of Behavioral Health Advocacy and Policy in the Office of Government Relations. And I have the esteemed privilege of advocating for increased access to quality behavioral health services for children across the Commonwealth. And next slide. So the behavioral health agenda is founded on Boston Children's Hospital's commitment to ensuring access to timely and high quality behavioral health care for children and adolescents across the continuum of care. Behavioral health encompasses the promotion of social and emotional well-being. It also includes the treatment of mental health conditions, substance use disorder, developmental and behavioral challenges, and trauma-related health conditions. We support culturally relevant and equitable models of behavioral health promotion, prevention, and intervention services for children and the establishment of a responsive and robust behavioral health workforce. We recognize that behavioral health care is an integral part of a child's overall health and should be fully integrated into all aspects of treatment and care. Next slide, please. So a main focus of this in this year's legislative session is to address the escalating psychiatric boarding crisis, which occurs when children wait days and weeks or even more sometimes in emergency departments and medical units due to a lack of appropriate inpatient behavioral health placement options. The numbers show that children and adolescents board for longer periods of time than adults and have fewer placement options. This legislative session, we will advocate for legislation that will promote increased access to acute psychiatric treatment options across the Commonwealth. Next slide, please. And so if you want to learn more about this, because this is an issue that I get the most questions on from advocates at the institution and beyond, is how can they do something about this problem? And how can they learn more? How can they advocate? Please join us next month, February 17th, for a special webinar that is focused on the behavioral health boarding crisis. And there we'll talk about how it impacts children and families, what is the Boston Children's response, and what are the current state and advocacy efforts to address the crisis. Featured speakers will include our very own Dr. Patricia Ibiziaco, who is the Associate Chief for Clinical Services, Nancy Scannell, who is the Director of External Affairs at MSPCC, and yours truly. Next slide, please. A next focus will be school-based behavioral health services. So supporting access to upstream school-based social, emotional, and behavioral health services for children and adolescents. This is particularly important in the time of COVID, but even before that, we want to support legislation that will address several root causes of inequitable access to school-based behavioral health services by establishing systems and protocols for creating and maintaining school-based behavioral health resources and ensuring that behavioral health needs of all students are supported. Next slide. And then finally, we want to focus on parity and integration. And parity, that means promoting behavioral health recognizes that insurance coverage for behavioral health conditions must be the same as coverage for physical health conditions. It also means that children with behavioral health needs should have the same access to primary care and urgent care services that children with physical health needs have. And so these are our behavioral health focuses in the state legislative agenda for 2021 and 2022. And so I'll kick it back to Jamie Gaines.
Thanks, Amara. I promise I've gotten some water, so hopefully we won't have to watch me choke through the rest of the Q&A. So right now I'm going to invite Shannon and Amara to join me back on camera. And thank you to everyone that submitted questions in advance. For those of you that didn't, or if you have questions from the presentation, please type them into either the chat box or the Q&A and we can answer them live. But I'm going to have the first question go to Shannon. Shannon, someone asked that all of the BCH advocacy opportunities have appeared to be in person. If these opportunities are still ongoing, how can we adapt them to our new remote life and how can I participate?
Thanks, Jamie. I think that is a question that we've all been grappling with, both in our professional lives and personal lives. I think it's important to recognize that legislators can be contacted still by phone. You can call their office. They also do have email addresses that they check. I always say also, if there's something that you are worried about in your community, even if you just want to, write a legislator email just saying, hey, I'm really worried about housing and homelessness, for example. They'll usually write you back and give you a sense of what's going on at the state. I always encourage emails. A lot of legislators hold office hours. If you follow them on social media or Twitter, they might have a Zoom setup that you can attend. And then just more advocacy wise, obviously, I know we've been encouraging everyone to sign up for the CAN for advocacy opportunities that we will have available. But we're also happy to help if you, are just interested in how the process works. If you'd like to listen to a hearing online, or if you'd like to listen to a debate, we're happy to get that, help you access that as well.
Thanks, Shannon. Amara, the next question is for you. Can you expand on what the phrase upstream school-based services means? We got this question a lot.
Sure. So upstream school-based services essentially means services that address the root causes rather than symptoms of behavioral health challenges that might come up. And so this would improve long-term outcomes, and it's essentially saying, how can we prevent downstream effects of anxiety by making sure every child has access to social and emotional learning in their schools. We all know that most kids are in school, so it's a good place to ensure that we are identifying ways to support social and emotional wellness.
Okay, our next question is for Shannon, and it came in through our Q&A box. Given that the expansion of telehealth was enacted through an emergency order, will there be efforts to make some or all of the telehealth coverage permanent post-COVID?
Great, thanks. That's a great question. So the governor on January 1st did sign a bill that is a 2-year agreement with the legislature to make some services permanent beyond, or not permanent, make some services available beyond the COVID emergency order. We'd be happy to send out, we have a very detailed summary of that bill, but just in brief, the new legislation does say that services must be covered for behavioral health at the same rates as in person permanently, which is a great win for behavioral health. It just also says that for 2 years beyond the state of emergency, that services must be covered at the same rates as in person for primary care and chronic care. And then there's some language that says that services must be covered via telehealth if they would be covered in person, but it doesn't specify what the rates should be. So we'd be happy to get out a full summary to you, and we do anticipate that the legislature will be revisiting this issue again to after the 2-year time period that the bill is currently looking at, and we will have for certain advocacy opportunities again once we take understand better what the legislature will be working on in the upcoming months.
Thanks, Shannon. And it's my guess that we'll also probably have a Caffeinate and Advocate specifically on telemedicine to help address some of these questions. Amara, next question is for you. Also came in through our Q&A box. Is there ongoing advocacy to increase reimbursement for behavioral health services?
I think that's a great question. And yes, there is. It's not always exclusively legislative advocacy. So Boston Children's Hospital is frequently advocating for increased reimbursement in behavioral health spaces on the regulatory side as well. So when we're going into meetings with Mass Health and others, what can we do to advocate for increased access in the behavioral health space? That's what we're doing ongoing. But also legislatively, last session, the governor introduced legislation to increase behavioral health reimbursement by 30%. And that's something that got a lot of attention and that we will be following closely to see that gets refiled again and how we would support that legislation.
Great. We got a question around how people can track the progress of different pieces of legislation. This is something that both the Office of Government Relations can help you with, but also you can do online yourself. If you go to malegislature.com, I'm going to have Alexia put the link into the box. You can actually look up and follow different pieces of legislation. You just need to know who their sponsor is or their bill number is or their keyword. And so you can check that online. Sometimes that system takes a little while to update or can be hard to navigate. So you can always check in if there's a particular piece of legislation that you're interested in with the Office of Government Relations. Amara, next question is for you. Recognizing that there will be a webinar on this next month, can you give us a quick bite of what the boarding crisis currently looks like at BCH?
Yes. So as I mentioned previously, boarding is when an individual comes into the emergency department and it is assessed that they need acute psychiatric treatment. However, there are no placements for them across the state. And so what happens is that they're waiting either in the ED, in the emergency department or on a medical unit, and they're not getting the acute level of care that they need. And sometimes at Children's, we have we have children waiting days, weeks, months for the appropriate placement. And so with COVID-19, that has actually escalated dramatically just because we've had inpatient units that have had to close down because of infection rates. We've had the workforce being really stretched in this space. So it's challenging for frontline workforce, but also for the children and the families. And so where we are right now is Children's Hospital from the very top, so from the CEO to the frontline staff is doing everything that we can to provide support for the patients that are in this situation. But we're also advocating at the State House. We're advocating with policymakers to see what they can do to make sure that more beds are coming online, more resources are in the community, and that the clinical care that we're providing is being stepped up.
Thanks, Amara, and we really appreciate your work and the work of everyone that has been trying to address the boarding crisis during this challenging time. Please join us for that talk next week, next month. It's going to be super interesting and really informative. Shannon, next question is for you, and we have a budget question. So someone said, thanks so much for having this talk. With much of the country facing economic difficulties and major budget cutbacks related to the pandemic, how do we anticipate this will impact legislative efforts and progress over the next year?
That's a great question and quite timely. So the governor will be releasing his budget tomorrow, where we will get to see basically what he lays out, what he thinks the state can afford to plan for in the upcoming fiscal year, which starts on July 1st. It'll probably be highlighted in the State of the State tonight, which is at 7 p.m. if anyone is interested in watching that. We will likely send out some kind of summary on the budget after we get to review it this week through the CAN. So if you're signed up for the CAN, you can get a look at that. I will say, just based on the revenue numbers, at least at the state level, the projections are not as dire as they once were predicted to be. We're actually in kind of an okay spot for right now. And with that, also from getting a lot of aid from the federal government to continue supporting a number of programs that the state is investing in right now with regards to like homelessness prevention and housing tenancy prevention. other food access programs, a lot of the social determinants of health we discussed. We will be sending out a summary soon, and I'll just say that we don't think it's going to be too bad, but things could always change. But I'm hopefully optimistic that we will be looking at an okay budget this year.
Awesome. Thanks, Shannon. And for those that are interested in kind of a little bit more about the budget and looking for budget resources, Mass Budget is a great Massachusetts-based nonprofit that really has some wonderful explainers about why the budget is so important. They actually also have a children's budget that you can go and you can read more about kind of the history of funding and how things work. So definitely check out that resource if you're interested in budget advocacy. Okay, so just a few more questions. This one is for Shannon and Amara. In light of BCH's recent declaration on equity, diversity, and inclusion, what capacity has the Office of Government Relations been working with the Office of Health Equity? And how has that informed the legislative agenda? And I know that Amara works really closely with the Children's Mental Health Campaign that has also been working on equity. So maybe you can both kind of speak to the different sides of the legislative agenda.
Sure. Well, I will start and then pass it off to Amara. We have reviewed these priorities with Dr. Ward and the Office of Equity and Inclusion to make sure that these are in line with what their office is working on. And we really want to, as things develop and progress, keep in touch with them to make sure that they're part of this conversation, and that other folks around the hospital also feel free to let us know as things come up. We're happy to take a look at it. We'll continue to work with them to make sure that the work that we're doing has input from their office. And I believe we're also planning some events with their office. So stay tuned on that as well.
I would add that the Office of Government Relations, in partnership with the Children's Mental Health Campaign, have really been thoughtful about who we need to speak to and bring to the table when we're deciding what we want to focus on in this legislative cycle, who we need to partner with, what voices need to be brought to the table to make sure that we're not being exclusive, making sure that we have diverse voices when we're thinking about legislation. How can we make sure that it's culturally relevant? How can we make sure that it is involving all different subpopulations? And so that's what we've been doing. We ask ourselves with each focus, how does this address racial equity? And we try not to answer that question in a silo. So I think that's how we've been addressing that.
Awesome. And I'm seeing lots of questions come in really specifically around behavioral health and certain diagnoses and what they're qualified for, and some really specific questions for Amara. Just as a reminder, you can reach out to any of us at any time for your really specific questions. We're going to keep it a little bit more high level here around the legislative agenda. But again, please reach out to Amara, please reach out to Shannon, and please reach out to myself. We are happy to sit with you virtually and discuss any of your in-depth questions. So just a few more questions that came in. Shannon, how does maternal mortality morbidity factor into our legislative priorities? And is there any work being done to address this at the state level?
Sure. So we included maternal mortality and morbidity. As we know, racial disparities continue to be persistent in the health outcomes of women, particularly for Black women, and that pregnancy-related deaths are 3 to 4 times higher than those for white women. The State House has established a commission to study maternal health and specifically the underlying drivers of racial disparities in this issue. And the commission is brand new, so they should be starting sometime this spring. We really felt it was important to include this on the agenda to recognize that maternal health is so closely tied to infant health, and that if we can support legislative efforts to improve the health outcomes for mothers, that this will also improve the health outcomes for babies as well. So we'll be looking to the legislature to see how their commission plays out, and if there's an opportunity for us to lend our expertise to the infant health aspect, I'm sure we'll be looking for help from around the hospital on that as well.
Awesome. Okay, 2 more questions. And again, if you have more questions, definitely keep them going in the Q&A box. This is for Shannon, Amara, or myself. Is there a way that we can help promote Boston Children's Hospital legislative agenda within our divisions or clinics?
I think the part of the answer is, just to encourage your staff to sign up for our newsletters and participate. If there are specific ways that your division would like to, specific topics that your division is more interested in learning in, we're certainly happy to come talk on specific topics to smaller meeting groups. And give you advice on ways to further get involved, especially if it's on a topic that is super specific to your area of interest. I don't know if anybody else on the team has something to add about that.
Yeah, I'll just shout out IDHA, who has a long and deep history of advocating for telemedicine. One thing that they used to do with us when we were in person is that we would host calling for change events. So we would come to either a staff meeting or during lunch and teach their staff how to call their legislators. And then we would set up specific times and bring scripts so that kind of everyone can do this mass advocacy at once and with the Office of Government Relations. So we are happy to set up virtual calling for change with anyone that would like, if they have a specific issue that they're really interested in. And if you just really like us and want us to come and talk more about our legislative agenda and then figure out how we can get your department hooked into our advocacy, we can help you talk through that option as well. We are here to help you figure out however you want to advocate. So one last question. Let's see. Amara or Shannon, what do we do if a bill starts to lose traction? We know that there is a lot of bills that are going to be coming through, many of them important. How do we make sure that our advocacy maintains its priority within BCH and within the legislature?
I'll start. I think it's very common for topics to ebb and flow at the State House. If there's a concern that a topic is losing traction, I would encourage you to reach out to us. Find out if there's always advocacy groups that are outside of our organization that are working, let's say, specifically on a topic, and that's all they do. So while our topics are wide and varied, we can help connect you to advocacy groups to see how to get that installed. Again, you're always welcome to email or call your legislator, ask where they stand on a bill, ask if they can contact, if they're not already if the legislator is not already a chair of a committee or in leadership, to contact the speaker or the Senate president to ask that they put it higher up on their agenda. And I know we've said this multiple times during this presentation, but we're always happy to help either you with the drafting of that or what to call your legislator and say. Our emails are all in the chat box. Please do not hesitate to reach out.
Awesome. Well, Amara, Shannon, thank you so much for your time. Thank you so much for helping me to share our new legislative agenda. We are really excited to be able to work with a wide range of advocates, both inside and outside of BCH, on this new direction for the legislative agenda. We hope that all of you will be right alongside us advocating for the next 2 years. With that, I will wrap up today's session. If you have any questions, definitely reach out to us. All participants will be getting a link to the recording, the slides, and all of our emails, but we're here for you no matter how you reach us. Enjoy the rest of your day. Thank you so much for coming and have a great day. Bye, everyone.
Thanks, Amy.
Thank
Thanks,
you.
everyone. Bye.